How do first-generation antipsychotics cause weight gain in schizophrenia? Imagine taking medication to help with mental health but ending up with unexpected changes in your body. That's often the case with first-generation antipsychotics used in schizophrenia treatment. These drugs are effective at reducing hallucinations and delusions, but they can also lead to weight gain. So, how does that happen? Let's break it down. First-generation antipsychotics work mainly by blocking dopamine D2 receptors in the brain. Dopamine is a chemical that influences how we feel pleasure and motivation. Blocking these receptors helps calm overactive brain signals that cause psychotic symptoms. But these drugs don't just target dopamine receptors. They also interact with other receptors that control hunger and energy use. One key receptor is the histamine H1 receptor. When these drugs block histamine H1 receptors, it can increase appetite and cause sedation. Sedation makes people less active, which lowers the number of calories burned during the day. Another receptor involved is the muscarinic acetylcholine receptor, especially the M3 subtype. Blocking these receptors disrupts normal insulin function and metabolism, leading to increased fat storage. This means the body is more likely to store extra calories as fat. Some first-generation antipsychotics also affect serotonin 5-HT2 degrees Celsius receptors, which are involved in appetite regulation. Although these effects are more common with newer drugs, they still play a role here. When these receptors are blocked, signals that tell us we are full get disrupted, leading to overeating. The combined effect of increased hunger and decreased physical activity causes weight gain. The hypothalamus, a part of the brain that controls hunger and satiety, is affected by these receptor blockades. This changes the signals that normally tell us when to eat or stop eating. Additionally, sedation from these drugs reduces physical activity, further lowering energy expenditure. Over time, this imbalance results in noticeable weight gain. It's important to remember that genetics, environment, and behavior also influence how much weight someone gains on these medications. This weight gain can increase the risk of health problems like diabetes, high blood pressure, and heart disease. That's why doctors monitor weight and metabolic health during treatment. Sometimes, they choose medications with less potential for weight gain or suggest lifestyle changes to help manage this side effect. To sum it up, first-generation antipsychotics cause weight gain mainly by blocking receptors that regulate appetite and metabolism. This leads to increased food intake and less energy use, making weight gain a common side effect. Managing this is an important part of treating schizophrenia effectively while keeping overall health in check.